Well, thank you, Mr Deputy President. I rise to take note of the answer to the question that was asked of Senator Abetz about the Medicare payment, and I'm thrilled that the Senator opposite has just highlighted the underlying problem with this whole affair, in that Labor do not acknowledge that so much of the structural spend that they have put in place over the last 6 years has put Australia on an unsustainable footing into the future. And if you look at the policy intent around the Coalition's policy for Medicare, it is about sustainability for the long term, to make sure that not only us here in this chamber in our old age, but our children and their children have a system that will support them. Now, Mr Deputy President, the dialogue, the narrative that those opposite seek to paint into the Australian community is somehow that Coalition senators don't care about Medicare and that the Labor Party is the sole protector of our healthcare system. Well, can I take you back? Can I take you back to the former Coalition government under Prime Minister Howard, when we had Prime Ministers Rudd, Gillard and Rudd? Their constant refrain and attack was that the Coalition was all about cutting funding to healthcare. Well, can I take the attention of the Senate to the Museum of Australian Democracy, which has fact sheets on different Prime Ministers, and they highlight just a few of the key achievements that those Prime Ministers achieved. And for Prime Minister John Winston Howard, AC, one of those key achievements was record health funding, which back then was $46.7 billion in 2006-2007. Now, just in case you think this is some kind of conservative think tank, the four people who were ex-members of parliament on their board include 2 members of the Labor Party, 1 Democrat and only 1 Liberal. And so the facts speak for themselves that the Coalition actually makes record investments into healthcare. Now, let's contrast that with the ALP when they were in government. Let's go and have a look at the 2012-13 MYEFO and look at the evaluation that was conducted there, not by the Liberal Party, but by the Australian Primary Healthcare Research Institute at the Australian National Unity, again an organisation that's not actually known for being a strong supporter of the conservative side of politics all the time. And what they said, and I quote, "The hidden disaster in the 2012-13 MYEFO is the hit, unacknowledged by anyone in the Labor government, taken by preventative and public health. We know that $1.5 billion over 4 years has been cut from the National Health Reform funding." Unquote. So what we see is absolute hypocrisy here from the members opposite, who seek to say that the ALP are the only people who care about health care, whereas the policy intent from the Coalition is clearly about making sure that not only do we provide, as we have in the past, record funding, but we provide sustainable funding for the healthcare system for Australia. They don't like hearing that, Mr President, do they, Mr Deputy President? They interject because they don't like to hear it. And so anyone who's listening to this broadcast can recognise that senators opposite don't like to hear the facts, and so they interject to try and muddy the argument. But let's look at the facts. Medicare has more than doubled in expenditure from around $8 billion to about $20 billion over the past decade, despite the proportion of Medicare spending covered by the Medicare levy falling backwards from about 67% to 54%. So the consultation that is ongoing now is because the government has realised that there is clearly not support in the public, and there is clearly not support from members opposite nor the crossbench to put in place measures to make Medicare sustainable. So the consultation that is going ahead now is to work with the AMA and other groups who are stakeholders in the industry to say, where can we make this more efficient? And what I hear is the AMA are saying there are savings that can be made, there are efficiencies that can be made, but as Andrew Lee, the Shadow Treasurer, has indicated in the past, one of the viable methods for that, and he has clearly supported the concept of having price signals. So the government has accepted that there is no support here for that, and we are looking for other savings. But the point is the policy intent of the Coalition in this area is to make sure that Medicare is effective and sustainable into the future, and our track records show that we have invested heavily in the health of this nation.